All right. So I know I can't see you all. I wish I could see you all. I wish we were in person so I could ask you all this. Anybody familiar with Sanford and Son? Thumbs up, hands, whatever. They run reruns, so you can't get away from it. Or, Mima or Grandma used to watch it, or pretty sure some of you all are familiar with Sanford and Son. So on this picture is Smitty and Hoppy. And they was a reoccurring characters that came in just in case Fred Sanford, played by Red Fox, who probably was in violation of his junkyard or maybe some disturbance. And I want to give a shout out to Hal Williams, who's played Smitty. He's the black officer who recently passed away at the age of 91. He was also on a hit show, 227. And so rest in peace to Hal Williams. He was an intricate part of the show as his character because they would come up, tell them a violation. Hoppy would tell them, they was in violation or a disturbance or something, and he would talk in cop jargon and legal jargon. And Fred and Lamont wouldn't understand what he's talking about. And so Officer Smitty will break it down and talk it in the jargon that Fred and Lamont will be able to understand. And so we're back at the jargon portion of it, speaking the language of the community. And so at the end of that scene, Hopper would say something and he'll try to be hip. And Smitty will correct him to make sure he's using the right terminology. So it's a very funny, they always have a very funny scene. They stole the show every time they came on. But it's a prime example of how we should manage speaking the information out for our patrons to potential healthcare professionals. So I'll get right into the slide. So the purpose of the presentation is to highlight the importance of the library staff's engagement with the public who are frequent visitors of the library. We already mentioned the trust that we have with our patrons and community members who frequent visit us, and how we sit down and we listen to, all of their challenges and issues. Also, as librarians and library professionals, um, we specialize in information behavior. And so presentation will highlight the importance of analyzing information behavior among library users. Um, then we'll turn to the librarian's role of being an accessible spokesperson for the community. A lot of you all in the chat spoke about your role in making sure that you are advocates to your patrons. So you all probably saw my project or it's probably in my mind, but we are at length on our thoughts on how we want to serve the public and promote health information and access. Utilizing a library resource that can play a major role with connecting healthcare professionals with the community. And also, the goal of this project is to present a model example of how libraries can assist the vulnerable communities. So I'm going to try my best to hit on all the topics that we all mentioned in the discussion. Okay, so we got some healthcare trends, and want us to pay attention to these trends as we go along with further discussion in this presentation. So I'm just speaking for North Carolina. I know we got some people from all over, and I'm glad that you all are here to join us, but I'm sure that you all have the same issues going on in your communities and in your state. Since 2005, 13 rural hospitals have been either closed or converted into rehabilitation centers. I know someone mentioned that they have a mobile unit that only travels. So that's one of the examples of what we're seeing as far as trends go. In North Carolina, about 74 of North Carolina's 100 counties have a shortage of primary care providers with a ratio of greater than 1,500 residents per primary care provider. This is very, very dangerous. And you all are seeing a semblance of people coming and visiting your libraries with certain ailments. So I want us to think about how we think about misinformation. Uh, we're going to come back to that as well. Cuts to Medicaid funding due to the passage of the One Big Beautiful Bill Act will cause many hospitals to operating margins to decline in the coming years. So that's something that we have to look out for, as well as more and more hospital and clinics probably shut down. Neighboring states have introduced bills to weaken vaccination rules or access. And what I say that is Virginia, Tennessee, South Carolina uh, have introduced probably more than 3 or 4 bills to weaken vaccination rules and access. And one of the big things that's going on in the Triangle area is Wake Med and the Charlotte-based Atrium Health has planned to merge, putting Wake Med under Atrium's corporate umbrella. That's a big deal as well as we talk about out-of-pocket expenses, insurance, and access to different types of care. So let's move on. Again, I'm located in Durham, North Carolina, and it's part of the Research Triangle area, along with Raleigh and Chapel Hill, if those who are not familiar. We are located on the south side of Durham, North Carolina, which is like adjacent to downtown. Most of our library, our users of the library are part of historically marginalized groups. And researchers from institutions such as Duke, UNC, Chapel Hill, Research Triangle Institute, and North Carolina Central University make frequent visits to the library with promoting local events and research trials to our visitors. So we get a lot of flyers and a lot of people within the healthcare profession will come and try to recruit or retain some of the patrons who come into our library because these are the people that they want to help and they want to get information. But there comes that thing about trust, the whole trust portion of, no, I'm not doing that. They might do something to me. So we'll put a pin in that as well. Also, because we're in a research triangle area and we have a lot of graduates and a lot of people in information, we are very fortunate to have a lot of health coalition groups in the area who's interested in assisting people who live in our community, especially with our marginalized population. And that's being, by Black, Indigenous, people of color. So working in the library, and a lot of you all do this, and a lot of people in healthcare and working in the public space, you all observe a lot of things from your patrons, a lot of things from your community members, and just the area at large. So there's some of the observations that I've made as I wanted to center community health within the library. Researchers are asking librarians to assist with community engagement. This is probably one of the last and one of the few places where people come freely and engage within themselves or other people within the library. Where we have like not only books, but we have computer stations, we have programs, we have just an open space where everybody just feel like they don't have to make a reservation to come in. They don't have to make an appointment to see anybody. There's no particular reason for anybody to be in here. Sometimes people want to be in here because it's too hot or too cold. Some people just want to clear their mind. Some people want to just take a nap. So we get a lot of people who just come in freely and just hang out, right? The majority of the researchers asking for collaboration are either medical students or young in their profession. So the luxury of being in Durham is that we get medical students who want to get into profession but want to blaze their own trail. They're trying to make a way. They're trying to figure out ways that they can help people in these marginalized communities. And so we get a lot of younger individuals who are hungry and really want to help, really want to make a name for themselves in the field of research and in health. Another observation is library staff are becoming an intricate part while assisting individuals who are going through mental health challenges. And so this is going back to the lack of access. This is going back to places where we find our clinics and primary care facilities shut down. Well, they're going to go somewhere. And they're going to want to talk to somebody. And so when you see somebody at the desk and look like they're not doing anything, and you see them every day, it's automatic that they're going to come speak with somebody that's a familiar face about anything. And what you'll find out is a lot of people are struggling, whether it's due to homelessness, due to death, addiction, just all other long-term health things that they really don't have an answer for. Uh, and I'm gonna skip over the growing demand in using library spaces, and I'm gonna go to this one that's very important to me. And I know that we spoke about misinformation. I'm a proponent in trying to inform the misinformed and disinformed. But we have to understand that every visitor who walked through the library are very intelligent. And what I mean by that is they might not know what you know. They might not have the degree. They might not have the professional training. They might not know how to search reputable sources about what they're dealing with, but they are an expert in their lived experience. And so once we get somebody to come in and say, well, I don't trust the vaccine because X, Y, and Z, although they might be wrong, it's still their lived experience. And at the end, we're trying to help them. We're trying to help them to think of it an alternative way. Let's just say that. Your way is helping you because of your lack of access, your lack of resources, your positioning in this society. This is where your thinking comes from. This is where your intelligence comes from. And as library professions and healthcare professionals, we have to take that and meet them. This is how we meet them for where they are. And so this is how we collaborate with an individual who we're trying to learn more about so we can help. And so everybody that walk in, they might not know how to use the computer. They might not know how to, they might not understand any reading material. However, their lived experience, they are an expert, and we need their guidance and how to assist them. So let's go to the next. So after the observation, what did we do here at Stanford L. Warren? So in the effort to promote the people we service at the library, we started participating in health events. And so instead of us waiting on, healthcare professionals to do programs at our library, instead of us just sitting around and trying to figure out how can we better connect with healthcare professionals and how we can connect them with the patrons we have, we started going out to community events. Speaking of community events, I have one this Saturday with the local health community center that's like a block away. I go every year to just to promote the library. And we see, I just see the same people who come to the library, who see a familiar face, wondering why we are here at a healthcare event. So that's nice to have, but just to let the healthcare professionals know that, hey, I'm a partner in this too, and I could help out a lot with my perspective. And so being part of these health events, it might take some time out of your day. Might be challenging because I like to get out there. I like to put my boots on the ground and market the library and market our service. So that's a big thing for me. Um, the next thing that we did was we became liaisons to many local health care groups. So Bull City Strong was one of the groups where it was during COVID that was created, try to get people informed about the vaccine, the importance of taking the vaccine, and with the hopes of, getting most of our population vaccinated. And so they saw that the library was a place where we are getting people who may not have insurance or may not go to the clinics, may not go to the hospitals. But these are the people that we needed to get vaccinated. But we needed to get them more information about the importance of vaccines. So Bull City Strong, Community Health Coalition are two of the primary health organizations that I'm a part of as a librarian. We reached out to groups and individuals who were doing research and organizing in the field of public health to speak about collaboration. So all of last year, I was in a number of meetings and letting them know that, hey, there are some people that you all wish to see. They're in this library right now. So come collaborate with me. You need me. Basically, you all need me to help y'all do y'all work. And I need y'all to, help the people that's at my library because they're suffering and they're sick. And so, but the biggest thing that we have and the biggest asset that the libraries have is our space. And so we open up the space for local and not-for-profit organizations to utilize for, meeting rooms to conduct meetings and programs that's geared towards health. So y'all can't tell anybody. I hope my boss isn't on this. But but what we did was we saw that it was we might see a health organization that want to do something here. And we just reached out to them and said, hey, you all are doing this thing, please use our rooms. And if you know anybody that has an organization that's devoted to health care and promoting healthcare access, we allow you to come use our meeting space, free of charge. You all are doing this amazing thing. And instead of y'all going to offices and going to places where might be intimidating, lack of transportation. Know some of you all said that there was a lack of transportation, that you might not have the money to, get a babysitter or anything. You want to bring them to the library. And so we have a children's and a teens library, and we can set up a program while we do this thing where you all are engaging with the community that's already here. And they trust us. And so we open our space to allow them to utilize the meeting space to connect with our people in the community. And so this is what happened. One of the few programs that we had that's geared towards healthcare and health access was it was a men's health dialogue. And it was a collaboration with the Duke Durham Health Thread Trust and Health Relationship through Education and Advocacy. And these are people who are medical students. Duke Cancer Institute, Community Outreach Engagement, and the Durham Men's Health Council for a forum discussion about men's health. And what we did was completely different. So how can I put this? So I'm gonna be very transparent. Uh, it's off topic, but on topic. When somebody say, well, and it's an unpopular opinion of mine, so don't shoot the messenger. I really don't like those financial literacy classes or financial literacy stuff, or we need to put financial literacy here in the schools, or we need to teach people about financial literacy. And I agree on that portion. Like it's good to know about financial literacy, but normally people like to use that to say that, well, the reason that you're poor is because you're not financial literate. And I'm like, well, I don't know about money or finances because I don't have any. And so I I I try to tread on like health or financial literacy stuff because I want to center the community. Again, everybody that walks through the library they're intelligent. They are experts in their field. And it's up to us as the researchers and the observer to learn about the people who walk through those doors, the people that's part of the community, so we can understand that language. And so this was a health event where we centered the people in the middle, the people in the community, about what they thought about healthcare professionals, what they thought about the healthcare system, what they thought about their primary care doctor. Who do they go see? What's their preference? We wanted to hear from them so we can understand how other health institutions could better collaborate with them in making them better. And so this was a great discussion. We had about 35 people who played Jeopardy. We had a great dialogue on health topics. One of the things that came out of it was we had a gentleman who said that, when you're at the hospital and they ask you for consent and how they want you to volunteer to do something. And the guy was like, hey, sometimes when I read this, it's like I'm not supposed to say yes to volunteering because I feel like I'm giving up something or I'm doing something wrong. And one of the people that was working clinical trials, it gave him an aha moment, like, wow, if we're speaking to our people in that way where it's making them intimidating, where they feel like they have to make a choice, and also they want to, they're sick. So it's already thinking that it's life or death, then we need to lighten up on how we present our stuff. We need to figure out a way that we can better connect to them in this way where we feel like we're not taking from them and using it against them and try to hurt them. And so we came away with, well, the healthcare professionals came away with how we need to better position ourselves, but they need to better position themselves in community engagement and how they could better present what they're trying to do to, see if we have a healthy society, a better, healthy community. So what did we learn? Create space for collaboration. Be open. A lot of you all work at the library. Please be open to collaborating with the healthcare professionals that's in your area, with anybody. If you don't have someone within that county, please go to conferences. Try your best to connect with other places, other people within your region to come in and assist with this because they want to help. They want to make sure that our communities are healthy. So create a space for collaboration. Understand who needs to be present for this collaboration. That means, you utilizing the connectivity of the libraries as it counters the different people who are involved. Invite the people that you see every day to these events. Tailor make the event towards the people who you encounter. Try to create a program. If you see someone that's dealing with diabetes, you go find somebody, even if it's one person, find somebody that's working with them diabetes to come to that library. And you might not get a gajillion people to come. It might be that one person, but that one person is able to connect with that healthcare professional. So try to tailor make programs towards a person that you're, encountering every day. Encourage healthcare professionals to play a role in the community engagement. Let them know, hey, please come to the library, hang out, do some of your work, do some of your, anything that you would do at home, do at the library so you can know the ways and the language of the community that you serve. But everybody on this talk, be a representative for your patrons. When they come in, make sure you speak. Make sure you ask them how's their day, how's everything going. Develop a relationship, a working relationship. It doesn't have to be personal, but a working relationship. So that way you can understand and observe what's the moves and what's going on with that person. So, and I'll leave you all with this. Don't overestimate what you know and don't underestimate what they know. We got the degrees, we got the position, we got the opportunities, we got the knowledge. Don't mean a thing if we don't understand the people we're trying to serve. It means nothing. They know a lot, and what they know can really help us help them. So don't underestimate what they know either. And I will, let's see, stop sharing screen. Let me know if y'all got any questions.
Yeah, thank you so much, Larry. Folks, do we have any questions? We had a really great comment in the chat from Tina saying it's important to be trained in adverse childhood effects, ACEs, and how that impacts processing, decision making, and behavior. Tina, would you be willing to share a little bit more about what ACEs is? Is that like a program or
Um,
certification?
sure, I'd love to. I actually did a training that I'm planning on doing with our librarians here in Central Florida during their professional development day. So,
Yeah.
ACEs is a nationally recognized assessment, and it looks at childhood effects of things like, are your parents divorced? Is there a parent that was in jail? Have you ever been in the foster care system? Domestic abuse, things like that. There's a series of questions. And if you get a score of 4 or more, then it goes into just projecting increased issues around, early pregnancies, substance use, and all of that. But it also talks about interventions, and there's a lot to do with the brain. The term I use to open it with is, we were designed to run away from bears, not live with them.
Mhm.
So when you live with them, you get this oversaturated sense of emotion and fight and flight, and all of the chemicals that go into that. And then you carry that kind of stuff into the classroom when you're feeling rejected, and you
Mhm.
have heightened levels of reaction. And one of the things that the social worker at Central Florida Library and I have talked about is, again, the community center piece, people coming in because it's hot, people coming in, to do job applications, and that kind of thing, waiting for buses, and just the number of events and write-ups that they get every day because they don't realize, but they might be pushing people's buttons by approaching them from behind, or there's just so much involved in it, and it's really worth looking into, because you can turn things around on a personal level. But even like within the classroom, if they gently shift, in within even the library or any setting, if they gently shift their approach with people that might have these heightened sense of fight and flight and all that, you can really change things for them.
Yeah, yeah, that's so interesting. I had never heard of this assessment. And I do think that's really helpful for um, serving patrons at all stages of their life,
Mhm.
and having that way to be able to sort of
Right, because
determine.
unfortunately it becomes generational.
Yeah, definitely.
Yeah. So I'm going to put, I have a poll presentation I did on it. I'm going to put a link to the actual assessment in the chat.
Sweet. That would be awesome. Thanks, Tina.
Perfect.
Larry, we have a question from Lauren. Have you been able to check in recently with the attendees of the Men's Health event and see how they're doing and how attending that has helped them?
Oh, I just typed that in the chat. But other than what I spoke about in the chat, uh, a lot of them found it very compelling because a lot of things that was mentioned during that event was the fact that we have a finite amount of time when we're in front of our primary care uh, physician because of the business part. And the business part gets in the way of the personal part that a lot of the healthcare professionals, they want to be engaged in. Like they want to know. They want to help you. Like they got into it to help you, to make sure that you're healthy. And so they thought that it was great that we had an event like that because, the time slot of, hey, I gotta be here in this 1 hour, or I don't want to be here overtime because of billing. And so they thought it was excellent that they got to speak freely to healthcare professionals and they got to meet them. The healthcare professionals had to present themselves as open, and there was a lot of them were vulnerable because there was a lot of things that they didn't have the answer to, and there's a lot of things that they disagreed with as far as like where they worked, as far as the time spent with the patient and answering questions. So we are focused on having another event that's similar to it, but we're going to discuss clinical trials later on this month because a lot of people have been asking like when we're going to do something like this again, just so they can have access to a healthcare professional. So great question. A lot of them was very excited about the event and they want to see more of those type of events at the library.
Yeah, that's such a good point about healthcare professionals, the way their days are structured or their work. You don't have that undivided time to be able to ask them questions, and the way that they're able to come into an open space for everybody and really share their perspective, I think is so useful. um, Tina, thanks for dropping the ACE questionnaire in the chat. I'm going to include that in the follow-up email that I'll send tomorrow, just so that people can have access to it. Any other questions? I know we're kind of winding down the hour.
And my bad for taking up so much time on the presentation.
No, no, not at all.
I get a little
Um,
long-winded.
Larry, I'm curious your thoughts for maybe our folks in libraries who are not close to large health science campuses and universities. Like, what can they do to work on this goal and this effort?
Good question. Um, so going back to the trends and going back to the mobile unit that someone
Hmm.
had mentioned, um, everybody that live in these communities, they know how much they love their community and love the people that's in it. And so a lot of people get compelled to start something and do something because they don't see a lot of things getting done. And so they'll
Hmm.
start advocacy groups and, things to advocate for, you know, whether it's prostate or breast cancer or diabetes. A lot of information that a lot of people want to spread and get out there to the public. A lot
Hmm.
of people have a go get them attitude that's, I don't see this getting done. I'm gonna do it myself. It's important for library professionals to try their best to seek these people out. Get out there and see who's doing this work. Because there's somebody that's doing some work. There's somebody in Robeson County doing the work,
Mhm.
trying to spread the news about health information because something happened to somebody that they love. Uh, there's somebody that in Central Florida, somebody that say, look, my grandma died of this, and this is was totally preventable, and I want to make sure that nobody else goes through it. It is your job to try to connect with these people. They're out there, and they want to connect with you. But see if there's any health events that's going on in your community. Uh, if it's not going on in your county, see if it's something going on in the neighboring county. Just be there, be present, get out there for a lot of the people, you know, and let people know that, hey, I'm here to help y'all too. I see these people every day. They want your care, they want your assistance as well. So go out there and be an advocate for the people that's frequent your library.